"Don't cut yet." The words were so quiet that, for a moment, no one in the operating room reacted. Dr. Michael Brennan already had the scalpel in his hand. The overhead lights were fixed. The monitors were steady. The surgical team stood ready, eyes trained on him, waiting for the first incision. Everything was exactly as it should be. And yet, something wasn't. His hand didn't move. Not because it was shaking. Not because he was unsure. But because it felt heavy. As if something unseen was gently holding it back. "Doctor?" one of the nurses said softly, thinking he might have hesitated. Brennan didn't answer. Instead, he turned his head slightly, just enough to glance toward the far corner of the room. There was nothing there, just stainless steel cabinets, a dim reflection of surgical light, and the quiet hum of machines that had never once failed him. He had performed over 2,000 surgeries. He trusted data. He trusted precision. He trusted what could be measured. Not this, not a feeling, and certainly not the sudden, unmistakable scent that reached him in that moment. Roses, faint, but real, in a sterile operating room where even a trace of perfume was forbidden. His chest tightened, not with panic, but with something he couldn't explain. A strange, steady calm, pressing against urgency. "Vitals are stable," the anesthesiologist confirmed, glancing at the screen. "All readings normal." Everything said, "Proceed." Every second said, "Cut." But something deeper, quieter, said the opposite. "Wait." Brennan lowered the scalpel just slightly. "Give me 60 seconds, he said. This time, everyone heard him. There was a pause. Not long, but long enough for confusion to spread across the room. "Doctor, is there a problem?" a resident asked. Brennan stared at the monitors. Still normal, still perfect, and yet that same feeling remained, firm now, undeniable, as if a decision made in the next moment would matter more than anyone in that room understood. The scent of roses lingered, then faded. Silence followed, heavy, expectant, and then one of the monitors flickered, just once, subtle enough that most would have missed it. But Brennan didn't. His eyes locked onto the screen. "Hold," he said more sharply now, because something was changing. Fast. And whatever had just stopped his hand was about to prove why. Dr. Michael Brennan was not the kind of man who believed in interruptions. At 47, he was one of the most respected cardiothoracic surgeons at St. Gabriel Medical Center, a hospital known for handling some of the most complex cases in the state of Pennsylvania. He was precise, measured, relentlessly consistent. Colleagues often said the same thing about him. If Brennan's in the room, the patient has a chance. Not because he was lucky, but because he didn't rely on anything that couldn't be explained. He trusted numbers, imaging, protocols refined over years of discipline and repetition. Even under pressure, his hands never hesitated. Not once. At least, not until today. He had grown up in a Catholic household. Sunday Mass, rosaries whispered in the evenings, a small statue of the Virgin Mary placed near the front door. But that life felt distant now. Somewhere between medical school, residency, and the quiet weight of losing patients he couldn't save, something in him had shifted. Faith to him had become symbolic at best, comfort for families, ritual for the grieving, not something that belonged inside an operating room, not something that could interfere with a scalpel. And yet, as he stood there, staring at the monitor that had just flickered, he felt it again, that same unexplainable resistance in his chest. Not fear, not doubt, something else, something that didn't ask for logic, only attention. Behind him, one of the nurses adjusted her position slightly. A soft metallic sound followed, the faint tap of something against her badge. Brennan glanced back, almost instinctively. For a brief second, he caught it. A small medal, silver, worn smooth at the edges. The image was unmistakable. The Virgin Mary. He looked away almost immediately, refocused on the monitors, on the data, on what he knew. But something had already shifted, because for the first time in years, Dr. Michael Brennan wasn't entirely sure that what he knew was enough. The patient on the table was Elena Ruiz, 34 years old, a single mother of two, admitted just 12 hours earlier after sudden chest pain that wouldn't go away. At first, it had seemed manageable, but the scans told a different story. Complication, hidden, dangerous enough that waiting was no longer an option. Surgery had been scheduled immediately. To Dr. Brennan, it was the kind of case he had seen before. Serious but not unusual. Challenging but within control. The kind of procedure that depended on timing, precision, and calm execution. And he had all three. Elena had been conscious just minutes before anesthesia. Long enough to ask one thing. Not about survival. Not about pain. But about something small. Please, don't throw away my mother's medal. Her voice had been weak, but clear. One of the nurses, Claire, had nodded gently. It'll be safe, she promised. The medal hadn't been allowed into the sterile field. Hospital protocol. So Claire had placed it carefully into a small clear bag, along with Elena's personal belongings. Still within reach. Still close. Before the anesthesiologist began, Elena turned her head slightly. Her eyes searched the room. Not for the surgeon. Not for the machines. But for that small bag. Claire noticed. She stepped closer, just enough so Elena could see it. The silver glinted faintly under the lights.
Elena exhaled.
A long, quiet breath. Then she whispered something. So soft that only Claire, standing nearest, could hear it. Stay with me. It wasn't directed at anyone in the room. Not the doctors. Not the nurses. Claire felt a chill run through her arms. Because for a second, felt like Elena wasn't speaking into the air, but to someone she believed was already there. Minutes later, the anesthesia took hold. The room shifted into motion. Monitors connected. Instruments arranged. Voices lowered into focus. Routine. Structured. Controlled. At least that's how it was supposed to be. Because now, with Brennan still standing still, scalpel lowered, and the monitors beginning to flicker again, this routine operation was quietly becoming something else. Something none of them had prepared for. Outside the operating room, the hallway felt colder than it should have. Elena's mother sat alone beneath the soft fluorescent lights. Her name was Rosa Ruiz, 62. Hands worn from years of work. Eyes that hadn't fully rested since the night before. In her lap was a rosary. Old. Wooden. Each bead slightly uneven from decades of use. She had been praying since the moment they took her daughter inside. Not loudly. Not dramatically. Just quietly, again and again. Hail Mary, full of grace. Her fingers moved from bead to bead with slow precision. Not rushed, not desperate, but steady, like someone who had done this her entire life. A nurse had come out earlier explaining the procedure. Complicated.
Urgent.
Necessary. Rosa had nodded. She understood enough, but not everything. And maybe she didn't need to, because for her, this wasn't about understanding every medical detail. It was about one thing, trust. She closed her eyes tighter. Holy Mary, Mother of God. Her voice trembled slightly now, not from panic, but from something deeper, the kind of fear that doesn't shout. It settles quietly in the chest and waits. A few seats away, a vending machine hummed. Footsteps passed. Doors opened and closed in the distance. But around Rosa, everything felt strangely still, as if time had slowed down just for her. Then, without warning, she paused. Her fingers stopped on one bead, right in the middle of the prayer. Her brow tightened, not in confusion, but in sudden attention, because something had changed. Not outside, inside. A warmth, soft, but unmistakable, spreading slowly through her hands, up her arms, into her chest. And with it, the thought, clear, simple, not in her voice. Tell him to wait. Rosa's eyes opened. She looked toward the closed doors of the operating room. No movement, no sound, just silence. But her grip tightened around the rosary. And for reasons she couldn't explain, She whispered it out loud anyway. Please, let him wait. Inside the operating room, time didn't slow. It sharpened. Every second became heavier, more expensive, more dangerous to waste. Doctor, we're losing time, the anesthesiologist said, keeping his voice calm but firm. Vitals are still stable, but we shouldn't delay much longer. Brennan didn't respond immediately. His eyes were fixed on the monitors. Heart rate steady. Blood pressure within range. Oxygen normal. Everything was exactly where it should be. And yet, he couldn't shake it. That same quiet resistance. Stronger now. No longer just a feeling, but a presence pressing against his decision. Run the scan again, Brennan said suddenly. A brief silence followed. Doctor? The resident blinked. We just confirmed imaging before prep. There's no indication. Run it again. This time, there was no hesitation in his tone. Just clarity. The kind that made people stop questioning. Claire exchanged a quick glance with the anesthesiologist, then nodded. Rechecking imaging, she said, already moving. Across the room, a younger nurse adjusted the instrument tray. Her movements were quick but slightly off. The tension was spreading, unspoken but felt, because something wasn't following protocol anymore. Something was interrupting it. Brennan stepped back half a pace, just enough to widen his view of the room. The overhead lights buzzed faintly. Machines hummed. Monitors flickered again. Longer this time. A single spike. Then normal. Did you see that? The resident asked quietly. Probably interference, someone muttered. But Brennan didn't look away. He felt it in his chest again. That same steady pressure. Not urgent. Not chaotic. But firm. Wait. Behind him there was a soft metallic tap. Claire's badge brushed lightly against the edge of the counter. The small silver medal clipped to it caught the light. For a brief second, it reflected something brighter than the room itself. Brennan blinked, just once, then looked back at the monitor. Hold everything, he said, this time sharper, final, because whatever was coming next was no longer a question of timing. It was a question of survival, and somewhere between instinct and something he still couldn't explain, Dr. Michael Brennan knew. They were seconds away from finding out why. The room fell into a different kind of silence. Not confusion, not hesitation, something tighter, focused. Imaging coming up, Claire said. Her voice controlled as she pulled the latest scan onto the screen. The display flickered once, then stabilized. Everyone leaned in. First, nothing seemed out of place. The same structure, the same angles, the same clean, expected pathways Brennan had reviewed less than 20 minutes ago. The resident exhaled quietly. See? It's the same. Wait. Brennan stepped closer. His eyes narrowed. There. A shadow. Subtle. Almost invisible. Positioned just off the original line they had planned to follow. That wasn't there before, he said. The resident shook his head instinctively. It had to be. Maybe the angle is different.
No.
Brennan didn't raise his voice, but something in it stopped the room. That wasn't there. Claire adjusted the contrast. Zoomed in. The shape became clearer, irregular, unstable, and dangerously close to where the first incision would have led. A quiet realization spread across the team. If they had proceeded, they would have gone straight through it. What is that? The anesthesiologist asked. Brennan didn't answer immediately, because in that moment, the monitors changed. Not gradually, not subtly, sharply. A spike in heart rate, a drop in pressure. Alarms began to sound. Vitals dropping. Pressures falling fast. The room snapped into motion. Orders were given. Hands moved. But Brennan didn't move right away, because for a fraction of a second, just before the alarms filled the air, he felt it. Not resistance this time, not pressure, but something else. A sudden warmth. Steady, certain, like a hand resting lightly over his. Guiding. He inhaled sharply, then stepped forward. A just approach, he said, his voice cutting clean through the noise. "We're not going in where we planned." No one argued, because now, the monitors had made it clear. Whatever had stopped him earlier had just saved the patient from something none of them had seen in time. And this surgery was no longer routine, not even close. "Clamp here," Brennan said, already moving into position. "No lower. 2 centimeters below." The room adjusted instantly. What had been hesitation only moments ago was now precision under pressure. "Pressure still dropping," the anesthesiologist warned. "We don't have much time." Brennan nodded once. "I know." But inside, he felt something different. Not panic. Not urgency. Clarity. Sharp. Unmistakable. As if the path forward had already been shown to him, and all he had to do was follow it. Retract. Scalpel. This time, when he took it, his hand didn't feel heavy. Felt steady. More steady than it had all morning. He made the incision. Careful.
Exakt.
Not where the plan had originally dictated, but slightly off, guided by something he still couldn't explain. "Keep suction ready," he said. "And watch that structure, we don't touch it." The resident leaned in, eyes wide. "How did we miss that on the first scan?" No one answered, because there wasn't an answer. Only the reality in front of them. The irregular mass pulsed faintly on the screen. Closer now. More dangerous than it had appeared. One wrong move, and everything would collapse. "Doctor, heart rhythm is unstable," the anesthesiologist added. "We're losing consistency." Brennan didn't look up. "Give me 10 seconds. But even as he said it, he heard it again. Not loud, not external, but clear. "Not there." His hand paused mid-motion, just for a fraction of a second. The room held its breath. Then, he adjusted, a slight shift in angle, barely noticeable to anyone watching. But enough. "Now," he said. The instrument moved. Clean, precise. And just like that, the monitor changed. Not violently this time, but steadily. Heart rhythm stabilizing. Pressure rising. The alarm softened, then slowed, then stopped. No one spoke, because in that moment, everyone in the room understood the same thing. This wasn't just skill. This wasn't just experience. Something had guided that decision. Something none of them could see, but all of them had just witnessed. And Dr. Michael Brennan, for the first time in his career, knew he hadn't been operating alone. "Heart rhythm stabilizing," the anesthesiologist said, his voice lower now. "Pressure's coming back up." No one relaxed. Not yet, because what had just happened didn't make sense. Not completely. "Maintain suction," Brennan said. "Slow. We don't rush this." His eyes moved between the surgical field and the monitors. Back and forth. Every second mattered now. But not in the same way as before. Before, it had been about speed. Now, it was about precision guided by something deeper. "Doctor?" the resident whispered, almost afraid to break the silence. "If we had gone in where we planned," Brennan didn't look up. "We would have hit it," he said quietly.
No emotion.
Just fact. And she wouldn't have made it through the first 5 minutes. The words hung in the air. Heavy. Real. Across the room, Claire felt her breath catch. Her hand instinctively moved toward her badge. The small silver medal rested there, still, unmoving, but for some reason, felt warmer than before. She swallowed. "Doctor, there's something else," she said. Brennan glanced up briefly. "Say it." "The scan. It's changing." Everyone turned. The image on the screen shifted slightly. Not dramatically, but enough to make the irregular shape clearer. Defined. Exposed. As if something that had been hidden before was now being revealed at exactly the moment they needed to see it. "That doesn't happen," the resident murmured. "Not like this." Brennan stared at the screen, then back to the patient, then to the monitor. Everything was aligning, not randomly, but precisely, like pieces falling into place at the exact second they were needed. "Stay with me," he said to the team. We follow this path, nothing else. No one questioned him now, because the monitors, the scans, the timing, had already proven something none of them could deny. This wasn't luck. This wasn't coincidence. This was intervention. Quiet, precise, undeniable. And as Brennan moved his hands with a calm he had never felt before, he realized something else. The fear he had carried into this room was gone, replaced by something steadier, something he hadn't felt in years. Trust, not in himself, not entirely, but in whatever had just revealed the unseen, and was now guiding every move he made. Pressure holding, the anesthesiologist said, but still fragile. Brennan nodded. We finished this carefully. The room moved with him.
No guastid motion.
No unnecessary words. Just focus. The irregular structure was now fully visible. Closer than anyone had expected. More unstable than the original scans had suggested. It pulsed faintly, almost like it had been waiting. Retract slightly, Brennan said. Not too much, just enough. The resident followed, hands steady but tense. A single wrong angle here, and everything would spiral. Doctor, we're approaching the edge, Claire warned softly. I see it. Brennan leaned in closer. His world narrowed. Not the room, not the voices, not even the monitors. Just this, the exact point where one decision would divide everything. Before and after. His hand hovered for a fraction of a second. Not hesitation, alignment. Then he moved, slow, deliberate, different from how he had done it 100 times before. Because this time, he wasn't following memory. He was following something else. Now, he said, the instrument engaged. There was a brief resistance, then release. Stabilizing. The anesthesiologist's voice rose. Heart rhythm improving, pressure climbing. The monitors shifted again. But not violently, not chaotically, smoothly, as if something had been corrected at exactly the right moment. Hold that line, Brennan said. We stay right here. The resident exhaled for the first time in what felt like minutes. Across the room, Claire pressed her hand lightly against her chest. The metal beneath her fingers felt warm. Not hot, just present. Brennan didn't notice, or maybe he did, because just as he adjusted his grip, he felt it again, that same steady warmth. Not around him, not beside him, but through him, like his hands were no longer carrying the full weight of the outcome. Continue, he said, and they did, step by step, carefully navigating around what had nearly taken the patient's life. Minutes passed, long ones, measured not by the clock, but by each movement, each breath, each shift in the monitors, until finally, vitals stable, the anesthesiologist confirmed.
No alarms. No speakers. No sudden drops.
Just steady. Alive. The room didn't celebrate. Not yet, because they all knew they had come dangerously close to losing her. Closer than any of them had realized. And the only reason they hadn't was because something, or someone, had stopped a single incision at exactly the right time. Maintain position, Brennan said quietly. We're not finished yet. But something had already changed. The urgency that had filled the room earlier was gone, replaced by a calm that didn't match what they had just been through. Unusual, unspoken, but shared. Vitals holding steady. The anesthesiologist confirmed again. Better than expected. Brennan continued, his movements precise. But now, every adjustment felt guided. Not forced. Not calculated step by step. But known. As if the next move had already been placed in front of him. Just waiting to be followed. Doctor? The resident whispered, watching closely. That angle. That's not standard. I know. Brennan didn't explain further. Because he couldn't. Not in a way that would make sense. Not in a way that would fit inside protocol. Not there. The words came again. Clear. Calm. Inside him. He didn't question them anymore. He adjusted. Slightly. Barely visible. But enough. The instrument moved through a narrow space. one they would have never chosen under normal conditions. And yet, it worked. Cleanly. Perfectly. Flow improving, Claire said, eyes locked on the screen. It's stabilizing faster than it should. The residents stared. That's not possible. But the monitors didn't argue. They showed it. Line by line. Beat by beat. Recovery. Not gradual. Not uncertain. But precise. Timed. As if something had intervened not just to prevent disaster, but to guide the healing itself. Brennan exhaled slowly. For the first time since the surgery began, he allowed himself to feel it fully. Not just the absence of danger, but the presence of something else. Something steady. Something close. He didn't look toward the corner of the room. He didn't search for it. Because now, he knew. Whatever had whispered, whatever had held his hand back, whatever had guided that one decision, was still there, quiet, unseen, but undeniably present. And in that moment, Dr. Michael Brennan stopped trying to explain it. He simply followed. Closing in 5, Brennan said. His voice had returned to its usual tone. Calm, measured, controlled. But something beneath it had changed. The team moved with quiet efficiency. Sutures placed. Instruments counted. Final checks confirmed. No one spoke about what had just happened. Not yet, because there weren't words ready for it. Vitals stable, the anesthesiologist said one last time. Stronger than when we started. That was the part no one could fully explain. Not just survival. Improvement. Unexpected. Unusual. Documentable. The monitors didn't lie. Brennan stepped back. Removed his gloves slowly. For a moment he simply stood there. Looking at the patient. At Elena. Alive. Steady. Still. Then he turned. Good work, he said quietly. The team nodded. But the usual sense of completion wasn't there. Because this didn't feel like something they had done alone. Claire unclipped her badge as she stepped away. The small silver medal shifted in her hand. She stared at it for a second longer than usual, then looked toward Brennan. Doctor, she hesitated. He paused. Yes, she wasn't sure how to say it, so she didn't. Nothing, she said softly. Brennan held her gaze for a brief moment, as if he understood more than she had spoken. Then he nodded once, and walked out. The hallway felt quieter than before. Or maybe it was just him, because as the doors closed behind him, the noise of machines, the urgency, the pressure, all of it faded, replaced by a single thought. Simple, clear. He hadn't imagined it. Not the voice, not the pause, not the moment his hand refused to move, and not what followed. For the first time in years, Dr. Michael Brennan allowed himself to consider something he had long set aside. Maybe, not everything that saves a life can be measured. Rosa stood up the moment the doors opened. She didn't rush forward. She just watched, searching Brennan's face for something she didn't have words for. He stopped a few steps in front of her. For a brief moment, neither of them spoke. Then Brennan nodded. Small, but certain. She's stable, he said. She made it. Rosa's eyes filled instantly. Her hands tightened around the rosary. Not in shock, not even in relief, but in recognition, as if something she had already felt had just been confirmed. Thank you, she whispered. Brennan opened his mouth to respond, but the words didn't come, because for the first time, he wasn't sure who the gratitude truly belonged to.
Rosa stepped closer.
Slowly, then reached into her pocket. She pulled out a small object. A medal. Silver. Worn.
Familiar.
The same one she asked about, she said softly. Brennan looked at it, for a second longer than he expected. Then, very carefully, he took it, not as a doctor, but as someone receiving something he didn't fully understand yet. I think, Rosa continued, her voice trembling just slightly, someone was with you in there. Brennan didn't answer. He didn't deny it either. Because now, he couldn't. Weeks later, no one in the hospital spoke openly about that surgery. But Brennan changed. Quietly. Before every difficult case, he paused, just for a moment, not to hesitate, but to listen. And in his locker, where only he could see, rested a small silver medal, a reminder that sometimes the difference between life and loss is a voice you almost ignore. If this story moved you, leave the word roses in the comments. And if you've ever felt something you couldn't explain, subscribe to The Quiet Miracles and share your story below.